Hi, everyone. Hope everybody's doing great. Just give me 1 second to get everything all set up on both Instagram and YouTube. So, hopefully, everyone's doing great. I'm really excited to be here and be spending some time with you tonight. I am actually tucked away at the Venetian Hotel in Las Vegas for a conference, but wouldn't miss the opportunity to spend some time with you and talk a little bit about fertility and the approach that we take. And most of all, in hopes that you can walk away knowing that even if you have had a really long journey, you've tried what feels like everything, you guys have been through the ringer, there could still be hope. And there's still a reason for you to look forward with hope, with feeling like maybe you haven't uncovered every stone. Maybe there are still things that could be uncovered that could help you discover how you can grow the family that you've been dreaming of. So, welcome. I can see many of you popping on Instagram, on YouTube. Again, I'm Dr. Jaclyn Smeaton. I'm so passionate about fertility and really happy to be spending some time with you tonight. If you guys do have questions, you can pop them in the comments on the Instagram Live or pop them in the chat on YouTube. And towards the end, we'll do our best to get to as many as we possibly can. So, I want to get started by sharing a story that I teased out a little bit in my stories yesterday about Elizabeth and Charles. Now, when they'd come in to see me, I wish I could say that their story was so unique, but so many couples that I work with have dealt with so many challenges when it comes to their fertility journey. In fact, a lot of times when I'm listening to them, it's hard to not get emotional, even as a doctor, because it can be so traumatic and so difficult. So, Elizabeth and Charles had actually been trying to conceive for 6 years. They had never had a successful pregnancy. Now, they had gone through IVF many, many times. They had depleted their savings going through IVF. They had done it several rounds and had various outcomes. There were times that they had very low response. So they would get a few eggs retrieved, but then a few would fertilize. They wouldn't be great quality. When they did genetic testing, many of them were genetically abnormal or mosaic. They had very few normal embryos. And they did transfer all of their normal embryos. They had probably 5 or 6 transfers, and none of those took. None of the transfers were successful. And so they really came in with a very complex case and with a lot of time and effort and energy spent before they were at my door. And they really came in thinking, we're really hopeful that you have something that you might be able to help us with, but their expectations were low. They'd really been kind of beaten down emotionally by the process. And so when we started to look into their story, they really had what the clinicians would call unexplained infertility, but it was really clear when we looked at both partners, they both had things that could be optimized. Now, first, when we look at Elizabeth, she was 37 when she came in to see me. They'd been trying for years. At this point, her egg quality was likely challenged due to being over the age of 35. I hate that term, like the geriatric pregnancies is what they use conventionally. It's distasteful and terrible. But the fact of the matter is that if you are over 35, it can be more difficult to conceive because your pool of healthy eggs declines. In fact, when we look at statistics about all the things that impact fertility, age is the biggest one for women. And we can't turn back the clocks and get younger unless you're freezing your eggs when you're younger. However, there's a lot we can do to help improve the eggs that you have left, help support, provide all the nutrients needed during their final maturation process. And I'll tell you, we can make a big, big difference in the quality of eggs, the quality of embryos, the response that you'd get in IVF, et cetera. When we looked at her partner as well, he had been told actually that his semen analysis was normal and that he wasn't part of the problem. Now, what's really interesting, and if you haven't watched my demystifying labs video, I'd encourage you to do that if you're curious about this. But I see this happen all the time, this very specific thing, which is men are told you checked the box, your sperm were normal, it passed the test, so you're fine. Let's focus on your wife, your partner. And what we tend to see is that when you actually look at the range of normal that gets published by a lab, the lab's reference range of what they mark as normal is actually the bottom fifth percentile for healthy men. So, what that means is that if you came in at 15 million sperm per mil as your concentration, that's what's considered normal. And that's if you're 16, the clinics tell you things look fine. If you're at 16, in a pool of 100 healthy men, 95 have higher sperm counts than you do. Only 5 are lower, right? That doesn't mean you're in the middle of the pack. It doesn't mean you're the best of the pack. It means you are at the very bottom. You are like just barely scraping out of high school, is how I would describe it. There is so much more we can do to improve the health of sperm. And that's the approach that we took with both partners, with Elizabeth and Charles. We ended up doing some advanced functional lab testing for them that looked at hormone balance, nutrient status, their level of inflammation in their body, their oxidative stress, their gut microbiome. And what we found was remarkable. What we found was that for Elizabeth, she had a very high level of cortisol in her body and a very high level of oxidative stress, which causes damage to cells. That gave us a direction that we could take to really help to improve that. And with her partner, with Charles, he actually had a lot of problems with mitochondrial function, which are the energy producing powerhouses of the cell and of the testes and of the epididymis. And without those being highly functional, the sperm cannot be developed properly. He also had a lot of oxidative stress around. So when we were able to work on both partners for about 3 months' time, both the quality of the semen, it improved. They decided they wanted to go another round of IVF. And this time they actually had a different outcome. They had far more eggs retrieved, about twice the eggs retrieved, which is always a great first sign. When they went through the fertilization process, most of them fertilized, and most of them were actually graded at a medium to high quality. And so they ended up transferring 2 embryos, and one of them took. And that was their first pregnancy. They're actually pregnant right now. So, congratulations to Elizabeth and Charles. If you guys are watching, we're so happy for you. And I appreciate you letting me share your story. Now, I don't know where you're at in your own fertility journey, but I do know that couples come with a wide arc. And there's kind of an experience path that might sound familiar to you. First is when you think, as a couple, I think I'm ready to have a baby, right? Then you start noticing that you're having some difficulty because I think most of us assume it's going to be pretty easy when we get started. But you might notice, okay, it's been a few months. It could be taking longer than really it should. So then you start to do some research, right? And from there, from the research phase, I'd say you start learning completely random advice, right? You might learn it from forums. You might learn it from following people on Instagram. Interestingly, like there's a ton of people on Instagram that talk about fertility. I follow a lot of them too. A lot of them are not doctors. And I would definitely make sure you know who you're taking advice from. Health coaches, dietitians, they're not without value. Acupuncturists, not without value. All of those things are valuable, but they shouldn't be consulting on the medical approach to care. So you start learning all this random advice. Maybe someone tells you you should be going gluten-free, you should be dairy-free, you should cut out this or that, you should stop exercising. Who knows, but you should take this supplement or that supplement. And then very quickly you start to get conflicting advice and things can feel really, really overwhelming, right? Then you start to seek for help. Now, the health help journey in the world of fertility in the United States is predominantly with reproductive endocrinology. So you might go for Clomid or Letrozole, an oral pill, and try on your own for a couple months. Then go in for some IUIs or try IVF. And then at that point, you're just in a cycle of doing IVF in hopes that it will work. You might change up the medication protocols, but fundamentally, you're working with the same eggs and the same sperm. Now, sometimes this succeeds. IVF can be helpful to overcome some challenges with infertility. It has about a 30 to 40% success rate for most clinics. So, not super high for the level of investment financially that couples go into it with. But some people do get success, but many others fail. Okay. Or they might have some complications. So, that can get frustrating and that can get really difficult for anyone. It wears on your financial resources, it wears upon your relationship, it wears upon your own kind of vision of yourself and the way you can achieve your goals. I know a lot of you watching are probably type A people who want to do things, they want everything to go the way that you plan. I'm that same way. I can totally relate. So, what do I mean when I say there can be hope with even the most difficult cases? Now, first of all, this is not wishful thinking. You cannot mindset your way into a pregnancy. Okay. I do really believe in having a positive mindset when you're trying to conceive. It makes a big difference to go into it with an open heart, with an open mind, with a positive mindset. But a big piece of that is that a positive mindset sets you up to make the decisions that are going to be benefiting your health and benefiting your fertility. Okay. Now, the other side of that is reducing stress. Having a hopeful mindset can help you reduce stress when it comes to the fertility journey. But with hope, what I'm talking about here is the most foundational change in perspective that you could possibly have when it comes to fertility. This is not hope when you read a random blog from a fertility expert or random hope when you spend $500 on supplements or on some kind of massage treatment or whatever it is that you've stumbled upon. The truth of the matter is that fertility is complex. Okay, it's very complex. Infertility is the result of one or oftentimes more, from what I can see, many different issues. What we have to think about is the health of the egg, the health of the sperm, the health of the uterus. All of those things have to be aligned. And that involves so many different body systems. It involves your digestive system. It involves your neurological system. It involves your immune system so heavily. It involves your hormonal system so incredibly. It's a really holistic, complex process. And so you have to take that holistic view. There is no like magic bullet. I know people always ask me, like, what are the top 5 things I can do to boost my fertility? And I actually heard a colleague, the paleo chef on Instagram, talk about this when it came to gut health. And she said, the best thing you can do is stop asking what the top 5 things are and take a more holistic approach. That doesn't mean focus on everything, but what that does mean is take small incremental steps. I don't know if any of you guys are investors. I talk to my kids about this because I never invested early. I never learned anything about it. I'm trying to get them to do it soon. But if you can change the trajectory by 1% on an investment, that compounds over time. And in a year's time, or 2 years' time, or 10 years' time, or 20 years' time, the difference from that 1% additional growth to where you would be is staggering. And that's the approach we take when you're trying to conceive, is doing that 1%, doing that small daily change. In fact, just as an aside, if you click on my link in my bio or you go to go.hellofertility.com, you can sign up for my daily email tips. And that's actually 3 months of tips that I send to you every day. And that's because the fertility battle is won on the day-to-day basis. There's no sexy magic bullet, unfortunately. So, what are the things that help you with healthy sperm, healthy egg, healthy uterine environment? It comes down to understanding what each individual's kind of makeup is. What are the strengths of your system? What are the challenges? We have to think about things like your diet, right? But not just here's a blanket recommendation. We do know the Mediterranean diet is a great diet when couples are trying to conceive, but there's additional customization that can be done to that based upon your specific needs. That might be based upon your genetics that leave you needing certain nutrients at a higher level than most people. It could be based upon your environment and what factors you're exposed to that your body has to constantly detoxify and deal with. BPA, chemicals in your workplace, all different kinds of things. Um, it involves customization of that, maybe food allergens that are bothering you that we have to tailor. So we can look deeper with that functional medicine lens to really get to a tailored place of nutrition. We have to also look at your overall lifestyle. What environmental pollutants are you being exposed to that we can manage? Also, my husband just joined. I love you too. You're wonderful. Thanks for the comment that everyone else can see. You're so sweet. Um, it comes down to the lifestyle factors. What environmental toxins are you exposed to? How much fresh air do you get? What's the water quality that you drink? Some of those things that are very basic and foundational can literally change your fertility. And each of those, like I said, not one big dramatic thing, but they each are 1%, and they each can help to change things over time for you. Your relationship and your stress and your well being, these are all incredibly important to talk about. And this is something that can be very strained when you're on your fertility journey, and something that, as a naturopathic doctor, you guys might not know, but we learn like 6 main modalities in naturopathic school. One of them is counseling. And one of my favorite teachers actually taught a concept that I love, which is called people as medicine. And he was telling us as students, like, you as doctors will be medicine to your patients, but also think about other people as medicine for them. Relationships can be medicine. They can also be an environmental toxin, right? But relationships can be medicine with your partner, with friends, with family, with random strangers in a yoga class, right? When you visit a fertility yoga class and you're surrounded by other women who are going through the same journey as you, even without speaking it, there's a camaraderie and a love and a support that you can really benefit from. All of those things, like I said, drops in the bucket. So when we look at things from a functional medicine perspective, I oftentimes hear patients that have kind of been put through the conventional medicine medical process. That is an incredibly helpful process. I am not anti-IVF. In fact, so much of what I do is helping women do things like support a successful fetal embryo frozen embryo transfer, or support a woman's egg retrieval to try to maximize the benefit that they're going to get. So much of what I do is supporting IVF, and functional medicine works great in conjunction with it. It also works great alone, helping couples conceive on their own. But when I hear a couple's story, you'll find that we ask a lot of questions. We ask about digestion, about your skin and your hair, and all of the other things that have happened in your life. Did you have asthma as a kid? Did you have psoriasis? Do you experience allergies, headaches, pain, thyroid problems? All of those things, fatigue, how's your energy? How's your hunger? How's your cravings? We go through all of that because all of those symptoms that a lot of doctors think are just completely unrelated. Why would we ever ask about it? You're here for fertility. Let's just help you make a baby. Why do we care about allergies? Well, let me tell you why we care. Because we know the physiology that leaves you at risk for allergies. High levels of oxidative stress, high levels of inflammation, a dysregulated immune system. And guess what? Those same underlying factors can influence your fertility. So all those random symptoms that you experience, we need to know about because it helps us to put all of those different things into like little mental buckets, right? When I think about the major buckets of like physiology that matter for fertility, it's immune function, good digestive health, low levels of inflammation, low levels of oxidative stress, great mitochondrial function, balanced hormones, right? So when you're telling us all these things about the PMS or breast tenderness that you get or the experiences you had as a child, we can start to put things into different categories. And oftentimes, what we'll find is one of those will become very heavy, very heavily weighted, lots of symptoms in that checkbox. And that points us to what kind of testing we should do. Sometimes there's more than one. And sometimes we feel like we need to just do a good evaluation of all of them, especially for people that have kind of complex medical histories. So we can do testing for all of those different areas, and that helps guide our treatment. And that's actually fixing the root cause because eggs can't mature healthfully if they're in a stressed environment. And when I say stress, I don't mean emotionally stressed. I mean like not good nutrition, not enough omega 3s, high oxidative stress, high inflammation. It's hard for any cell to function at its best in an unhealthy environment. So we have to understand what exactly is happening and work to fix that. So I just want to say this is not an advocacy for you to book an appointment with me. Okay. I actually have very limited schedule and I'm about to bring on another doctor. I can't wait to make that announcement. A doctor that's been working with me for the last 2 years under my mentorship. And she's going to be joining with greater availability so we can help more people because I'm overflowing. But I do want to make sure that whoever you choose to work with is someone that understands that functional medicine approach and can really help you customize your plan. I don't want you on any blanket fertility protocols. I want you to do a deeper dive with that functional approach, looking deeper at your lifestyle, at your basic blood work. I didn't get into that much tonight because you can listen to that on, there's YouTube videos on lab interpretation, but even the most basic blood work, we can learn so much from. We can learn whether you have a high risk of environmental toxins like BPA, PFOAs, all of those things. Or not, just from your basic like CBC and CMP. It's really, really cool. So watch that video so I can talk you through that. But I do want to make sure that you are looking for a provider who can do all that for you because you don't want to have to do it alone. It can be onerous and taxing and like one more thing that you have to do. So I do want to share a really big announcement that I'm really excited about. For the first time ever, I am launching a consumer facing program, a patient facing program. So you might know or you might not know. I know several of you that are on the call are clinicians yourself, but over the last 15 years, I have been teaching doctors the methods I use to get patients pregnant successfully. It's so fun for a couple of reasons. One, I get to meet amazing clinicians, and fertility functional medicine docs are like heart centered, loving people that are so anxious to help others. It's so beautiful and it's such a great community to be a part of. I also get referred cases from people. I hear from people all the time about the stories of the couples they've helped. And that's like the best thing to me is being able to hear that I've been able to share information with another clinician who's been able to apply it with a patient to make a difference in their life. It's amazing. Actually, funny enough that I'm saying this, welcome Dr. Dugan, welcome Beatrice, two of the docs that have worked with me extensively under the mentorship program. So they're here too, and they're listening and still trying to learn more pearls, which is what I love about you guys, always wanting to learn more. But for the first time, I'm going to be teaching this directly to you, to the couples who are trying to conceive. I'm so excited because in January, we will be launching the Fertility Fix. This is a 6-week program. It really is like a 12-week program packed into 6 weeks because there's just so much that I want to share with you. It is so comprehensive. It covers really almost everything that I do with my patients. And it's going live on January 9th. I'm so excited. And today we opened up the sign up for the course. And if you decide to sign up now, you actually can get 10% off the Fertility Fix. And what that is spending many, many hours with me. It includes pre-recorded content, like 2 to 3 hours per week, plus a Q&A live every week that you get to join in. And then there are tiers for the program that include me giving you a second opinion on your labs, kind of giving you some guidance on what to look for. And then the top tier level, the advanced support level, we actually work together over 3 sessions and you do all of the functional lab testing that I routinely do with patients. It's an investment and the investment is almost all labs. It's really to give you the best information possible for your case. So I'm really thrilled about that. I can't wait to kick it off. And we're going to be covering things like nutrition, environmental medicine, all of the underlying factors that we talked about: gut health, thyroid health, adrenal health, stress, relationships, movement. What else? What am I missing? We're going to cover all of the assessment process. We're going to cover how to know your cycle. So if you're not going through IVF and you're trying, we're going to cover all of your hormones. We're going to cover your menstrual cycle. You're going to understand your menstrual cycle as good as all the doctors that I teach. You'll be able to teach your doctor about your menstrual cycle and about your hormones. Then we talk about fertility signs. We talk about how to time conception to be optimal for your specific situation, because sometimes it's not best to do every other day during your fertile window. There are times where that's not preferred. Then we go into all of the different treatment approaches. We talk about nutritional supplements. We talk about acupuncture. We talk about how to find a good provider, really covering everything and guiding you through that process so that you can follow along with your own workbooks, go through the process that I go through with my patients. Okay, there's 3 different tiers for the program. There's a self-motivated. There's no direct engagement with me, but you'll get access to all of the pre-recorded content. Then there is the supported mid-tier. That's where we have one session. I will give you a review of your labs and a customized nutritional supplement recommendation plan. And then the advanced support, like I talk about, where we work together over 3 visits and you really get the opportunity to do your own functional testing labs and really understand what's going on. So you're welcome to sign up. Like I said, it's open. You can go to hellofertility.com and you'll see under programs, Fertility Fix. You can read all about the details of the program. It goes very much into depth over everything that we're going to cover, everything that you'll get, and you can sign up for it there at that 10% off. The 10% off code is early bird, just so you know, in case it doesn't say that on the site. Now, this is totally risk-free. So I don't want to take money from anyone who doesn't feel like they can benefit from what I have to offer. It's just part of my integrity. If I see a patient and I spend an hour with them and afterward they come back to me and say, you know what, this is really not what I expected. I'm not happy with this. It's not really what I'm looking for. I am so happy to refund that money and let them invest it in a way that feels more aligned for them. That's just how I roll. Okay. And it's the same with this program. We're going to kick off on January 9th. Once we kick off, you have 2 weeks to decide whether this program is for you. And so you have a 14-day, no questions asked, money back guarantee. Okay. So as long as you've been doing the work, you've been attending the sessions, you've been streaming the videos, you've given it a fair chance. If you decide this isn't really what I'm looking for, that's totally okay. I'll refund your investment and you can go along on your way. So really very low risk here. When you're on that page, there's an FAQ section, so check that out. If there's questions that you have that aren't answered on the FAQs, some of you ask really great questions. There is a button there that you can submit a question, and I'll actually be doing another talk. I don't have the date yet for that, but keep an eye on Instagram, and I will be doing more in-depth discussion about the program specifically, really walking you through it. But this is the time that you can get that best 10% off discount if you think that you're interested in it. So let me go ahead and see if I can take a couple of questions. Okay, someone asked, why would I charge for the program knowing how much fertility care costs? I absolutely do know it costs a lot of money. This is an outpouring of really everything I've learned over the last 20 years in the clinic. And of course, I'm a doctor, so my livelihood is made by seeing patients. And this is just a great way that I actually can provide care and support for people on a broader basis that actually is a lot less expensive. So it's my way of actually trying to provide this information at a much better value. Now, if you visit the website or you follow me on Instagram, you know I share a ton of free content, really valuable content. So if you're not in a position where you can afford to pay for a program, that's totally okay. Download some of the free guides that we've put out. You'll see incredible guides like a second opinion lab interpretation guide. That is like what I use with my patients. I put their labs up against that guide, and I'm giving you essentially the summary of what the research says about labs for fertility, not just what the lab says about what should be a normal range in general. Let me give you a good example. TSH is a good measure of thyroid stimulating hormone. Now, TSH, if you look at a lab range, the normal is between 0.5 and 4.5. Okay. When it comes to fertility, that's wrong. The normal range is 0.5 to 2.5. So if you're between 2.5 and 4.5 with your TSH and your clinician has told you your thyroid looks great, they don't know enough about fertility because the range for fertility is different. This guide is actually a freebie that helps you understand what the optimal range looks like for men and women for fertility. So, anyhow, lots of good freebies. And I encourage you to take a look at those because you can definitely learn a lot. The difference of this program is that it puts it together in a very easy to follow way. So I always tell even the docs I work with, the patients I work with, you could search on the internet and find all of the information that I would share with you eventually. It's been a 20-year journey in medicine for me of studying, of reading published research papers, of reading fertility and sterility journal and all the OBGYN journals to kind of consolidate this information. So you can find out the what, but what this program gives you is the how, the step by step in the guide, and really takes away the overwhelm that it can feel when that pressure is on you to be the one to solve that puzzle. And instead, you get to give that up and hand it over to me, and we will walk you through step by step by step. Okay, Leslie, you asked, how is inflammation measured? Is it blood work? So, yes, inflammation can be measured in blood work in a variety of different markers. A couple of really great ones are C reactive protein called HSCRP or high sensitivity C reactive protein. That's a really great one to measure. A couple others include like sedimentation rate. There's a lot of different markers there. So, it's a kind of a fuzzy picture. It's not a single marker like TSH. It's a little bit tougher to get a picture of, but we look at 5 or 6 different markers to get a good view of what's happening there. We can also look at inflammation in specific areas, like inflammation in your gut. We can look at your immune system's activity. If it's overactive, that's suggestive of inflammation. So there's a lot of different ways that we can look at it that would be kind of a screening tool, and then after that, based upon your symptoms. Wonderful. Well, I really appreciate everyone spending the last 30 minutes with me. Hopefully, you learned a lot and you understand a little bit more about the functional medicine and naturopathic approach to fertility that we offer. Again, if you think you might be interested in the fertility fix, you can go to hellofertility.com and then click on the program's fertility fix, and you can learn all about the program. Again, the early bird code is early bird. If you think that this might be a good program for you. And I encourage you to sign up now. And again, no risk. If you start the program on January 9th and you decide within the first 2 weeks, this is not for me, I'd be happy to refund your money. Jillian asked, where could we find that lab guide and video? Those are also, if you're on Instagram, so if you go to my bio, you'll see all those things linked in my bio. All right. Thank you guys so much. I really appreciate you attending. And I hope you have a really beautiful night tonight. And most importantly, I hope you can take just kind of a cleansing breath with me here. This has been a long journey for you potentially. If you're at the beginning of your fertility journey or whether you've been in it for years, I'm really sending all of you my love and my baby vibes, and really let me know how I can be of support and help to you along the way. I wish you all so much love and luck on your journey. Thank you.